Hello there. My name is Yudi, and this is the Yudi Factor, a program where we empower you with information. Today, my guest is Professor Olatunji Efaino. He's the professor and head Department of Psychiatry, College of Medicine, University of Lagos, and also honorary consultant psychiatrist, Luth Idiaraba, Lagos. He'll be talking to us on mental health. Mental issues always arise during a recession, but even though Nigeria is gradually coming out of a recession, the goodies have not started cascading down yet. So we're going to be talking about mental health. Don't go anywhere. This promises to be very informative. We'll see you after this time out. You're welcome back, Prof. Thank you once again for coming to empower us with information.
Thank you very much.
Initially, we planned on talking about mental health in a recession. But now that we are told that Nigeria is gradually coming out of a recession, even though, like we discussed off camera, the goodies haven't started cascading yet. So we're going to talk about mental health in Nigeria. So what is mental health? How do you know somebody has mental issues? Especially now that there are certain offenses, traffic offenses you commit, and it's in Lagos State, and they send you to psychiatric hospital to go and find out if there's actually something really wrong with you. Here, especially when you drive one way. So is that the kind of mental health we're talking about, or we're talking about serious issues? Prof, welcome again. Thank you very much. So what is mental health?
When we talk of mental health, it's always an interesting issue. Yes. But I will start with health, the definition of health. The World Health Organization gave this definition that health is a complete state of physical, mental. As a psychiatrist, I emphasize the word mental. Yes. So it's a state of complete physical, mental, and social well-being of an individual, and not just the absence of disease or infirmity. Now, the definition of mental health is not so straightforward because of some issues. Number one, when we talk about mental health, we are talking about the behavior of an individual. Who determines a normal behavior?
Okay.
What behavior is normal? And the definition of a normal behavior has to be situated on certain factors. For instance, an appropriate behavior with respect to age, an appropriate behavior with respect to timing, an appropriate behavior with respect to the setting, an appropriate behavior that there is constancy. It's not variation that is unexpected. But then, even the mental health still came up with a definition that mental health is a state which is relative rather than absolute, in which the individual is able to, maximize his or her potential, is able to work effectively, relate appropriately with others in the society, and is able to contribute to the well-being of the society. Okay. And the same thing, even the definition given by American Psychiatric Association captures the same message. But then, as I mentioned earlier on, there are some controversies or issues about it because of what is normal and abnormal. Sometimes there's a thin line between normality and abnormality. But then, there are certain mental illnesses that are very obvious to everybody.
Yes.
But there are some that may not be obvious to people that are not trained in mental health. And in clinical practice, we crudely divide mental illnesses to things like minor mental illnesses and major mental illnesses. But then there are a lot of issues and controversies about this division. But for a better understanding, we just do that. Now, when we talk of major mental illnesses, those are the ones that are obvious to the members of the public. Yes. The individual is behaving in such a way that is not in consonant with realities of life. And normally we call those ones psychotic disorders or
like
psychosis.
Like the ones we see on the road.
Exactly. For instance, the manifestations of this psychosis include like hearing strange voices which other people cannot hear, seeing things other people cannot see, and having some delusional beliefs, that is false beliefs. And again, they behave in such a way that obviously this individual has lost touch with realities of life. But then, this is just a small subset of the mental illnesses in actual practice. There are a number of mental illnesses that individuals can suffer from that other members of the public may not be obvious or private to. They suffer in silence until they seek for help on their own. These are the so-called minor psychiatric disorders. In quote, I'm using the word minor in quote,
yes,
because some of them can be quite distressful on the individual. And again, these are the commonest types of psychiatric illnesses in the society. I will give examples, like anxiety disorders, depression, post-traumatic stress disorder, substance use, that is substances of abuse. Even certain types of epilepsies are mental illnesses. Certain types of
How about
epilepsies.
postpartum depression?
Exactly. Postpartum, not only postpartum depression, but we call them postpartum psychiatric disorders. Although we know that postpartum depression is about the commonest major one. Those are psychiatric illnesses following childbirth.
Yes.
But the commonest of them, fortunately, is a very minor one, and it resolves on its own, what we call postpartum blues or maternity blues. It's a self-limiting psychiatric illness following childbirth. But the ones that will require professional attention or treatment, the commonest of them is what we call postpartum depression.
Which after childbirth, the mother does not want to have anything to do with the child or something like that?
Yes, after childbirth, there are lots of problems with behavior of the mother. For instance, with postpartum depression, it's a type of depression following childbirth. And we know there are symptomatic manifestations of depression. The major symptom is that of depressed mood or extreme forms of sadness that is persistent in the individual. Other symptoms can include loss of interest in things that would normally interest the individual, and there can be withdrawal from social interaction. There can be problem with sleep, insomnia, usually of late onset. That is, the individual is able to sleep on time, but wakes up unusually early and is unable to sleep till daybreak. But with respect to postpartum depression, there are other symptoms. The individual can lose interest in taking care of the newborn baby. Okay? Sometimes there's even the risk of infanticide, of the mother killing the baby in the extreme or severe form of postpartum depression. So it can be a very serious thing. And that is why once the relatives or members of the public see telltale signs of postpartum depression, such individual should be brought to the attention of mental health professionals, psychiatrists.
Hold the thought, Prof. Hold the thought. Don't go anywhere. We'll be right back. You're welcome back. If you're just joining us, our topic today is on mental health, and my guest is Professor Olatunji Aina. Prof, this whole issue of mental health is something that, to most families, when it happens, it brings shame. I'm talking about mental illness, and most of them just want to go and lock up the individual away from prying eyes. Are there any warning signs that it's an onset of mental illness?
The question you ask is so relevant in our society. One of the major problems or obstacles to mental health practice is that of stigmatization. Mental illnesses are highly stigmatized, and that is why family members try to conceal this problem until it gets out of hand. Now, there are many reasons why mental illnesses are stigmatized. There's a poor misrepresentation in the mind of the general public. For instance, the media, they portray people with mental illnesses in an awkward or wrong manner.
Very bad light.
Bad light. They believe mentally ill are dangerous. They believe mentally ill they are difficult to relate with. They believe mentally ill can attack anyone, which is not true. the subset of people with mental illnesses that are dangerous, they are not more than 1 to 2%. But because of this media portrayal,
Movies.
the stigmatization is quite high.
Yes.
Oh, you mentioned the word movies now.
Yes.
I've carried out research on Nigerian movies.
Yeah.
I try to watch over 400 movies to study the portrayal of mental illness on them. And it's quite distressful that mental illnesses are generally portrayed in bad manner. Now, coming back, now people say that why mental illnesses is stigmatized is because of the risk of inheriting the illnesses. That is the causative factors. But I tell people, true, mental illnesses can be inherited, can be genetic, but it's not the only illness in practice that can be inherited.
Yes.
Others can also be inherited. But all along, even historically, in Africa, tracing back to the history, our great forefathers, they believed then if anybody wanted to get married, they will investigate for 4 things. They will investigate for sudden death in the family. They will investigate for mental illnesses. They will investigate for leprosy. Okay? And they emphasize a lot on mental illnesses. They will also investigate for epilepsies. So once any of these is present in the family, in those days, I'm not talking of nowadays of Facebook marriage or whatever, Instagram, whatever type of marriage. But in the olden days, a family marries somebody to the family. So they will investigate for those things. But the way mental illnesses are portrayed in the society is wrong. It's not, the dangerousness is overemphasized. There are quite a number of people with mental illnesses that they suffer in silence, especially with the ones I mentioned as, in quote, minor psychiatric illnesses like anxiety, depression. They suffer in silence. You cannot know except they tell you. Okay? So we psychiatrists try as much as possible to disabuse the mind of the public that mentally ill, they need help. Mental illnesses can be treated effectively when you take them to psychiatric facilities. I decide to use the word psychiatric facilities, not necessarily psychiatric hospitals, because apart from the well-known 8 federal government-established psychiatric hospitals in the country, some states, their general hospitals have psychiatric departments. All the teaching hospitals, they have psychiatric department. For instance, I'm from the Department of Psychiatry, Lagos University Teaching Hospital.
Yes.
So all the teaching hospitals, before they can be certified to train medical students, they must have a well-established psychiatric department taking care of patients. So these are available. And thank God there are effective treatment modalities for psychiatric illnesses nowadays. So the high level of stigmatization is uncalled for.
What are the earlier ones, if one had a loved one?
Yes, coming back to the second part of your question.
Yes.
You cannot talk of mental illness without talking about changes in behavior. And you cannot talk of mental illness without comparing to what is normal. Now, the issue of normality that is always controversial in the definition of mental health or mental illness is situated in what I call the subculture to which the individual belongs. The subculture is the pivoter, is the yardstick of measuring the obvious deviation in behavior. For instance, let me cite an example. Okay. I'm a medical doctor, primarily. I'm just a professor in terms of academic qualification or academic promotion. As a medical doctor, there are certain behaviors that are expected of me because of the profession I belong. So that profession is the subculture I belong. Yes. Then apart from that, I have my own social subculture. I'm a Christian. If I go to the church, there are certain behaviors that are expected. There are certain behaviors that are not expected of me. So now, if an individual as a Christian goes to the church, and while the pastor is preaching, he begins to shout, it's a goal. Man U has scored against, and he's demonstrating euphoria.
Yes.
The behavior is not normal for his age in that setting.
Yes.
That's number one. Then the definition again has to be situated to multiplicity of abnormal behavior in multiple settings. He has demonstrated that abnormal behavior in the church.
Yes.
At home, instead of the usual night wears, he decides to put on his agbada regalia with all sorts of things to sleep. And he becomes violent against the wife and children, which is unusual of him. Somebody has been a gentleman,
yes.
And they notice that change in behavior of violence, irritability. And in the night, they find out he goes to the kitchen, he goes to the sitting room, he's rested, he's not able to sleep. It's another sign. That's a manifestation at home. Now, in the place of work, there are some levels of decorum expected in the place of work. He manifests abnormal behavior again. You've seen that there's a change in behavior known of him occurring in multiple settings, and there is persistence. It's not temporal, because there are certain things that can cause temporal changes in behavior. If somebody is tipsy under the influence of alcohol, you expect some changes in behavior and you expect it to be temporal. But the definition of mental illness, there has to be persistency of the deviation of the normal behavior known with that individual and known with the subculture, and there has to be persistency. Now, there are certain things that are false telltale signs of mental illnesses.
Hold the thought, Prof. Hold that thought. Don't go anywhere. We'll be right back. You're welcome back. If you're just joining us, we are in the final segment of talking about mental health. And Prof, you were just about talking to us about telltale signs.
Yeah.
Okay.
Telltale signs include change in behavior. The individual is behaving in an unusual manner known with him. Secondly, there may be problem with sleep. So those who live with him will notice changes in his sleeping pattern. There may be restlessness. The individual can be unusually irritable. There can be excessive preoccupation with worries, particularly with things like anxiety. The major symptom is that of worries, fear of the unknown. Then for major mental illnesses, there can be other severe symptoms like hearing strange voices, seeing strange things other people cannot see, suddenly developing false beliefs, which is not in consonant with his or her sociocultural background, and is persistent and is held to even in the face of a contrary logic argument. So you know that something is wrong with this individual. Yeah. Then again, in some cases, for instance, like depression, the individual can be moody most of the time. You notice that he's sad most of the time, and there's withdrawal from social interaction. I can recall that in the other program, you mentioned the fact that if somebody has not been seen by his contemporary for some time,
yes.
Social withdrawal is one of the important manifestations of depression, for instance. So all these are warning signs that something is definitely wrong with this individual. Sometimes, somebody that has not been known to take alcohol, as one of the first signs of mental illness, can begin to abuse alcohol and other substances. Okay? The work can be affected. The productivity begins to decline. At home, the care of the home, for instance, by a woman, can become hampered. Okay? A loving husband suddenly becomes irritable and is persistent. All these are telltale signs that something is definitely wrong. So when we see this, it is advisable to seek help early before things deteriorate to a very severe form. But I must tell you that the mention of the word stigma is one of the inhibiting factors to people seeking for help early. But advise people, because of the effective treatment modalities nowadays, people should go and seek for help. If you don't want to go to psychiatric hospitals, I mentioned that there are psychiatric departments in teaching hospitals, federal medical centers, and general hospitals, and even some private initiative, private hospitals with psychiatric practice.
If, take for instance, you're trying to get the person to go to hospital and the person becomes violent and refuses to go, what do you do? I've watched movies where people are put in a straitjacket and all things like that. Is that necessary?
Well, thank you very much. You see, when a mentally ill person refuses to be treated,
Yes.
he or she lacks what we call insight. In psychiatric practice, insight means correct awareness that the individual is ill. But somebody that suffers from a major mental illness may lack insight.
Okay.
In that situation, he is not taking the right decision on his own. So the significant others in his life have to take decision to take him or her to a psychiatric facility. There are quite a number of legal issues about this. Most of the time, people are confused as to what to do.
Yes.
Sometimes you seek for legal backing. Yes. Because some patients, when they are forced to the hospital, they turn around to sue the doctor.
Wow.
And the hospital, yes.
Even when you know that they are not...
Exactly. When they get better, some of them turn around to institute an action. So the relatives have to get the legal backing. Go to magistrate court or go to the police station. Declare that you are the mother or the father or the wife or whatever of this individual and is ill. And those ones, when they see, they will give necessary paper for forceful hospitalization and treatment. In the olden days, people used to force them without, but because of what we have learned about lawsuits coming on and people enforcing their right, there are provisions in the legal framework to make such people compulsorily be admitted and be treated. But
This is
that
just
brings me
a digression.
Yes, that brings
come-
me to something.
Okay.
In Nigeria, I will use this opportunity to say, psychiatrists will have a lot of problem because what we call Mental Health Act has not been passed by the National Assembly. We've tabled this mental health something before the National Assembly for over 13 years now.
13?
Yes, and we are still using the Lunacy Act bestowed on us by the colonial masters, which the UK has jettisoned for years with new mental health. So I'm using this opportunity to appeal to our National Assembly members to quickly pass this Mental Health Act. It will be to the well-being of mental health practice in this country so that the practitioners, the patients, the relatives can be well protected in the course of psychiatric practice.
The Mental Health Act, what does it say?
Basically, it contains provisions for the right of the patient and appropriate treatment that should be given to that individual.
If somebody has a mental problem, mental issue, psychiatric problem, and is taken to the hospital and admitted, how long do they stay there?
It's difficult to predict. It depends on the problem. Sometimes we may say this is a major, serious psychiatric illness, and we just situate it may take some weeks or months. But sometimes you see them responding within a few days. But generally, within the matter of few weeks, they are discharged. But there's a caveat. After discharge, there is still need for them to continue taking their medication and going for clinic follow-up. Sometimes there's a large misconception in the mind of many people, many members of the public. Mental illnesses, a large percentage of them can be effectively treated.
If caught early?
If caught, well, even if caught late, although we know there are problems with that, but they can still be treated. Sometimes patients have recurrence of the problem when they default in using their medication and going for clinic follow-up. Most of the time, you sit with people in the bus, the next person seated to you may be mentally ill. But because he's using the drug, he's going for clinic follow-up, you cannot know. You cannot. So I advocate for effective treatment and people that are mentally ill to be going for follow-up and use their medication. And again, check their lifestyle. There are certain lifestyle practices that are no good.
What?
The use of alcohol and other psychoactive substances is not compatible with mental well-being.
Okay.
So a mentally ill should abstain as much as possible from substances of abuse. They should as much as possible live a stress-free life. Life cannot be completely free of stress, but
should be able to
as
handle
much
it
as
well,
possible.
try to handle it
Then
well.
again, the use of their drug compliance to clinic follow-up and use of their medication. Then as much as possible relate effectively with others in the society.
Prof, before we go, let me ask you one question. There was time in Lagos State, well, I don't know if it's still there, when you drove one way, they'll send you for psychiatric evaluation.
Yeah.
You're committing a traffic offense or driving one way and being sent for, does it have anything to do with psychiatric problem?
Well, the problem has been taken a step further.
Okay.
Because the Federal Road Safety Commission
Yes.
has adopted that sending traffic offenders for psychiatric evaluation. Well, my association has come out strongly against this.
Okay.
That is the Association of Psychiatrists in Nigeria.
Yes.
Has taken the position that that is wrong. Agree some traffic offenders may have mental illnesses.
Yes.
Those ones, they can be, they can seek for for treatment, but not necessarily situated because they are traffic offenders.
Yes.
Traffic offense is a civil offense, and they should be taken appropriately to court. It is the judge that will determine whether this individual should go for mental health assessment. So what the road safety is doing is not accepted to the psychiatrist because it's an abuse of psychiatric practice. You cannot say, okay, why not say people that are traffic offenders are hypertensives? They should be sent to cardiologists. Why psychiatrically?
I mean, they think it's a mental situation that you see.
It's a civil offense, just like some other civil offenses. It's a civil offense that should be appropriately handled legally.
And not.
It's a way of stigmatizing mental illness again. And that is why the association has taken strong position against that. You don't stigmatize mental illness by labeling somebody that has committed an offense as being psychiatrically ill. It's wrong.
Prof, thank you so much. Thank you. I'm always so humbled that you find time to come and discuss issues with us. Okay. And I'll invite you back because I know we're going to have fallouts from this so that you'll come back and answer the questions that will arise from this.
Thank you.
I'm humbled. Thank you so much, Prof.
Thank you.
I'm grateful.
Okay.
Don't go anywhere. We'll be right back. People with mental illness should not be stigmatized. And it's the stigma that makes people run away from going to for treatment. If you're out there and you have anyone who has mental issues or you've noticed a deviation in behavior and you think with all the symptoms that the Prof has talked about here, well, you take a trip to the psychiatric department and it will be solved. I'll appeal to Nigerians that even mental people you see on the streets should not be stigmatized. And those of you who do movies and stigmatize people with mental behavior, I think it's high time you stop it. Anybody, whether sick or not, their dignity should be maintained. That's my factor. Goodbye, God bless, and see you again next week.